Howdy, howdy.
Good morning.
Good evening.
As you can see, we have an awesome special guest, and it is Dr. Phil Smith. Hi, Phil. How are you?
Hey, good evening where I'm at.
For sure. And, Phil has been gracious enough to come on. He put together an awesome presentation and talk on inflammation and carnivore. So we are so happy to have you on here, and we're putting this together for you guys, and also for a kind of a video record, because we had this the other day in the open chat in the SPG gang. If you guys don't know what that is, definitely go check it out and sign up. But it was such a hit that we decided we should probably get it recorded. So Phil came on here so we get it recorded so we could share it with everybody. Thanks for being here, Phil.
Well, thank you.
All right. So where should we start? Should we start by bringing up the flow chart, or what do you think, Phil?
Well, let me talk a little bit about me for those who don't know me. So
yeah,
I'm 67, retired family physician who did clinical practice for a little over a decade, then went into clinical informatics, which means I'm a computer nerd, and I automated hospitals across the U.S. and Canada for most of my career, and taught at the master's level, wrote a couple books, invented some software. So I've done quite a few things. And I got into the carnivore community almost a year ago. I'll be coming up on my 1-year carniversary on August 2nd. Started August 3rd of last year. So I'm in my 12th month right now. So just finished 11 months.
Wow.
Did carnivore, told my story on YouTube during an interview with Bella at the Steak and Butter Gang, and had metabolic syndrome that was complicating my biggest health issue, which was getting a myocarditis, which is an infection of my heart, in 2001, which I fortunately survived, but it wrecked my metabolism and made me hypothyroid, and I really wasn't thriving very well until I got on to carnivore, and in 4 months I was able to totally reverse metabolic syndrome, and from that point on I've really been trying to understand this craziness we call carnivore. I'm not a carnivore doctor. I'm a doctor who does carnivore, but I have a master's in human physiology that I got when I was in medical school. And so I love to teach physiology to people so that we can have discussion about things and make sense of very complicated concepts that you may be questioning, what's this carnivore all about? Why does it work? Will it help me? And tonight we're going to spend a little time talking about obstructive sleep apnea and talk about the role of inflammation in that, and how inflammation is the center player of everything, most things that people deal with in life that are keeping them from good health. And we'll talk a little bit about the tryptophan pathway as well. Tryptophan is an amino acid that's the precursor for serotonin, which is really important for mental health, because when your serotonin levels are deficient, you are prone to depression. And that's a very common thing that's increasing in the United States. And I assume in Australia, Lindy, as well.
Yeah.
We're seeing a lot of metabolic syndrome. We're seeing a lot of diabetes, prediabetes, and autoimmune diseases. So hopefully I'll unravel a lot of that tonight over the next couple of hours as we talk about it.
That's awesome. Well, thank you so much for being here. And I know, I mean, is there any disease out there that doesn't seem to stem from inflammation?
Getting hit by a car.
Right. So this is you're saying that this might be a fairly relevant conversation for people.
Gunshot, nuclear blast. I can think of a few, but
that's awesome.
When you think about cancer, when you think about diabetes, when you think about autoimmune diseases, depression, anxiety, hypertension, the big things are pretty much related to inflammation, excess inflammation in our bodies. And if we can understand inflammation and deal with that, we can begin to achieve better health.
Nice.
And I'm not here to say the carnivore is the only way to do that, but it seems to be very successful. And I love your intro video that the three of you have put together, because you're inspiring. The fact that you've all started over 700 pounds and you've done so well at reversing lifelong issues with your health. And you all are thriving now, and not yet to your goals, but certainly doing things that you haven't done for years. And I'm always inspired every time I hear your stories. So I appreciate you having me on today.
Thank you so much.
That's why we do it.
100%.
I only have one question for Lindy. I've never been to Australia, but does the toilet actually go clockwise or counterclockwise?
I'm not a big fan of looking in the toilet, so I don't know. I didn't even look at it in Texas. I just do my business and flush. So.
Well, inquiring minds want to know. So
yeah, you just might need a clean picture of a video. Make sure it's not reversed.
There you go.
So
we can't rely on YouTube, because sometimes YouTube turns things backwards. So
what I want to know is isn't there like a spot where you can get right on the edge of those two poles where it just goes straight down or something?
Yeah, who knows?
Well, Todd, when you come and visit us in November, you can. We'll do a video on the 12th.
I'll live stream it, Phil. November.
Yeah.
November, the truth will be known.
I have a friend from Ecuador, so I'll ask him what happens in Ecuador.
There we go. That might unlock some. There might be a correlation between magnetic poles and like certain metabolic disease. Who knows?
Yeah, who knows?
Who knows the correlation? Well, that's awesome. We want to say anybody. So as we get into this conversation, anybody that has questions, please put them with a Q in front of them for Dr. Phil. If they are something we haven't already gone over or answered by the time we get to it, we will ask those questions and address them. So I appreciate it. Well, Phil, definitely take us away.
Yeah, I just figured out how to see the chat. So give me a second to look.
Well, no worries. There's only one question in there right now. And Phil, if you look, when I do this, if I hit this button right here, it'll pop up on the screen so you can actually see it.
Yeah. And I don't have a recipe for electrolytes. I don't take electrolytes except when I'm fasting. I put some salt on my tongue. If I don't do that during anything 36 hours or longer, I have to supplement with some salt, or I'll get really bad leg cramps. But I don't take electrolytes normally. So there are a lot of formulas out there, and that should be pretty easy for you to find.
There we go. Oh, sorry. And let me go back to that. All right. So no questions yet. That was the only one, but I'm sure it'll be coming in as we go.
So the reason we're doing this talk tonight is I did this on a live stream that wasn't recorded. So we wanted to have a recording of talking through inflammation so people have a reference of something they could watch, show to their family members, whatever. So we're going to talk a little bit about inflammation, but we're going to start with talking about obstructive sleep apnea. So Michael, if you can put up page 1 of my PDF there. So there are 2 types of sleep apnea. There's obstructive and there's central sleep apnea. So 90% of people that have sleep apnea, which is apnea means a lack of breath. So nih comes from the Greek for breath, and a means not. So it's like sleep apnea is when you quit breathing during the night. And I have a list of articles, and Michael, if I send those to Todd,
Yep.
I'll post them.
Yeah, let's post them. Let me do that real quick while I'm thinking about it. I made up a list of peer review articles that we can put in the live stream notes.
Perfect.
For references. So let me get that going so that can be posted by Michael so people can.
That's awesome.
Get that going while we're doing this. Okay. So the interesting thing is prevalence is when we're talking about prevalence, we're saying how frequent are people in the society having sleep apnea? And notice that prior to 2008, men versus females, males versus females is a 2-to-1 ratio. For every male, there were 2 males for every female that have sleep apnea. But all the studies that have been done after 2008 is suggesting that women are now having more sleep apnea than even men are. And we don't know why that is. Could be diet related, could be lifestyle related, could be anything. It could be that we're testing more females now and not assuming that you have to be a male to have sleep apnea. But we were talking about 4% of women and 7% of women of men having sleep apnea prior to 2008. And now that they've done more testing, we're finding it's a lot more prevalent than we thought, because we're now doing home sleep studies and finding it. Dentists are looking for it now. So we're not just related to sleep studies only done in inpatient settings. So that's kind of interesting. So as I said, obstructive sleep apnea is the most common type of apnea. There's actually 3. 90% of sleep apnea is obstructive. So that's this typical overweight, snoring, lots of inflammation, and daytime somnolence or drowsiness. And you can see here that it causes inflammation, but can also be caused by inflammation. Congestive heart failure, atrial fibrillation, pulmonary hypertension, which is an elevated blood pressure in the right side of the heart as opposed to the pressure of the systemic hypertension that we talk about. When we talk about having high blood pressure, we're talking systemic hypertension. That's what you measure at your arm. But pulmonary hypertension is measured by echocardiogram and by catheters put inside the heart. And that also complicates valvular heart disease. It ages your heart valves and can lead to congestive heart failure as well, and arrhythmias. Cognitive impairment, which is, we probably know more as brain fog, not being real clear on the way we think. And then I said daytime drowsiness, but there's an association with anxiety and depression, poor sleep. Hypoxia is basically lack of oxygen, so your tissues are starving for oxygen, and that leads to increased stroke, and it leads for insulin resistance, which means your insulin's not working well, and you're starting to get metabolic syndrome or even diabetes as a result of obstructive sleep apnea. So these things are very much related. We used to think smoking was a factor, but It's really questionable if smoking is really a factor for obstructive sleep apnea, because we don't see a greater incidence related to smoking only. So it may or may not be, but obviously obesity is, and anything that causes your airway to be malformed, like you have a large tongue or you can't open your mouth very wide, a lot of allergies and nasal obstruction, polyps in your nose, all kinds of things can cause airway malformations. And then central sleep apnea is when your brain stem more specifically, is not functioning normal. And that's a defect that could be primary, meaning it started within the brain, or it could be secondary to something such as a stroke or some other toxic process in your body. That's about 8% of all sleep apnea. And then complex sleep apnea is if you have both. And that's, but if you have both, we still treat you for obstructive sleep apnea, because there really isn't any good treatments for central apnea other than continuous oxygen. CPAP, which is continuous positive pressure airway devices, which is a mask that you put over the face and you wear at night. There are all kinds of devices you put in your mouth, taping the mouth, devices to open the airway, braces, splints, and then weight loss has been shown to provide help to obstructive sleep apnea. But one thing we notice in the carnivore community is that snoring, which is a marker for sleep apnea, actually goes away within days of starting carnivore when you're really strict, long before you have any weight loss. So it seems like the inflammation is often the bigger factor than the weight itself. So thinking that you need to lose weight alone, that's the only way to observe obstructive sleep apnea, that would be a fallacy. And Michael, I see you are listing all the references, but if you can also put them in the show notes on YouTube.
Yeah, we will.
Yeah,
That would
we
be
will.
great. There are actually 2 inflammatory markers that are present in most people with obstructive sleep apnea, not everyone, but one's called tumor necrosis factor alpha, and the other is interleukin 6. And these are novel markers. They're not markers you're going to get at your normal doctor's appointment, but they're doing research with these, and you'd have to probably go to a research center or pay a lot of money to have those done for yourself. But they are present in people with obstructive sleep apnea. And if you notice Todd's photos, Todd, in the introduction, Todd was on oxygen 24/7, right?
Yep, it was 6 liters.
Yeah, and I'm sure that at that point you had obstructive sleep apnea and you probably had pulmonary hypertension as well.
For sure. And that was about the time I started using a CPAP too.
Yeah. So when you see people that have low left ventricular ejection fraction, which is a sign of congestive heart failure, and they go on carnivore, you often see their sleep apnea symptoms go away, and you see an improvement in the left ventricular ejection fraction, and that's due to reduction in the pulmonary blood pressure, the blood pressure between the right and left sides of the heart. So
I don't know where this plays in, but one chronic thing I used to have was right across here. There was something when my heart was beating hard that would tighten up, like it just felt like something was squeezing it with a fist. And it was whenever my lungs were working hard and my heart was pumping hard, that would tighten up so tight, and it felt like an elephant was sitting on my chest. And I haven't had that in
well,
6
think about it, that all these things cause the heart to work harder. Okay, so you're basically putting your heart and your kidneys and everything else under strain. when you have obstructive sleep apnea. So your brain, your heart, your liver, your digestion, everything, and even your sexual function. So if we go to the next slide, Michael. So I made up, based on going through the literature, we'll let Michael change the slide here, page 2. There we go. Thank you. And this is a chart that I made up. And if you read through all those articles I posted, you'll see scientific proof for all of these different things. And if you look on the right, and I don't know if my cursor shows up, probably not. So if you look at obstructive sleep apnea and you see there's a bracket that's blue on the right, obstructive sleep apnea can cause all of those things that are blue bracketed. That's why there's an arrow that's going both ways. Meaning, when the arrow goes both ways, that means that can be a cause or it can be caused by. So you'll notice most of these things in the diagram have two-way arrows. So erectile dysfunction can be caused by inflammation, but erectile dysfunction in and of itself does not cause inflammation. So it doesn't have an arrow pointing at inflammation. So that's how you look at this. And you'll see that impaired cognition does not cause inflammation. Anxiety does not cause inflammation. Depression doesn't cause inflammation. But obviously, if you're anxious, your inflammation's going to be accentuated, but it's not going to be caused by it, okay? So I made this diagram because most people don't realize with the increasing prevalence of 1/3 to 1/2 of the population possibly having sleep apnea now in the Western society, the question you always have is, are my insulin resistance, my impaired cognition, my depression, anxiety, my risk of stroke and erectile dysfunction, and then is that related to sleep apnea or is that related to inflammation? And the point I want to make is you really want to target inflammation because it has so many downstream effects. You gain weight when you have inflammation. Obesity causes inflammation. Inflammation causes metabolic syndrome, and the more metabolic syndrome you have, the more inflammation you have. Same for diabetes, autoimmune diseases, heart diseases, such as congestive heart failure, valvular heart disease, arrhythmias, atrial fibrillation, and atherosclerotic heart disease. And everybody's so worried about their cholesterol. They really should be worried about inflammation because, and I left cancer off of this diagram because I didn't want to go down that pathway tonight. But there's also an association of inflammation damaging your mitochondria and leading to mitochondrial dysfunction leads to neogenesis, which is the formation of tumors, and sends you down another pathway. So,
just from the layman's term here, what I love about your flow chart here was I just always had, when I was going through all this, I had this gut instinct that, they were sending me to heart doctors, lung doctors, all this stuff, getting all these tests with all these different drugs. And I was like, they're treating all these things. And I never felt, I was just like, I'm just not that unlucky to have this many things that, I think there's a common cause. And that's why I went with Carnivore. I felt like that had to be the thing, that all these things, that there was something common to it all. And obviously, from this chart, the common denominator for me must have just been massive inflammation from my diet.
And once you get one condition, it adds to the inflammatory load, which causes more conditions. And
it always feels like you're in a catch-22 or in
yeah.
Or something.
And how many times in the carnivore community do you hear about people that have 4 or 5 or 6 autoimmune diseases?
Right.
They
That's very
don't
common.
have one, they have multiple.
Yeah.
And, whatever you label the autoimmune disease is not important. It's the fact that your body is revolting and attacking itself because it's so inflamed that it's producing excess of inflammatory factors, which are to the excess of the point that it's actually attacking your own body.
Right.
And some people, that's being manifestation as psoriasis or eczema or rheumatoid arthritis or multiple sclerosis. I mean, you name the disease. And people get caught up on, well, I go to a rheumatologist to see my rheumatoid arthritis, but I go to my dermatologist to treat my eczema. You're really treating the same underlying cause. And, the medications that we're using are to modulate or to mediate the inflammation. Why not get rid of the inflammation as the cause? And when I was a kid, I remember the Aesop fable about the lion and the mouse. Everybody remember that, where the lion has a splinter in his paw, and the mouse takes the splinter out of his paw, and they become friends for life.
Yep.
And inflammation is the splinter in your paw, and you need to remove it from your body. So anyway, let's stop there for a minute. We have a couple questions.
Yeah. So why don't we start with the SBG commented questions first, and then we'll go to the SBG chat questions, and then we'll go to the live chat questions.
Well, some of those aren't related to inflammation. So
okay.
Can we do the live ones first? I'm sorry.
Yeah, we can definitely do. No worries. We can definitely do the live ones first. So let's see here. We're going to get rid of this one. This one's not super related to inflammation either. Some of these, I guess we'll just fire through these really quick, and we'll spend more time on the inflammation ones. How do you find a carnivore doctor in North Carolina? I think, doesn't Dr. Baker's site have basically Rivero? Isn't Rivero doing that, where they're putting together like a network of carnivore doctors?
Absolutely. And we have, the keto doctor over at Duke University in the family practice department.
Okay, so that's a quick answer. Check out Rivero, Dr. Baker. That'd be awesome. And then question, I weigh 305, have sleep apnea on triology machine. How will you know you can get off the machine without? Let's see, did he have?
Well, you don't know until you reduce the inflammation and you become asymptomatic, and then you get retested. And there was somebody on SBG that just a couple of days ago that was reporting she went from like 58 apneic episodes per hour down to 2 or 3. I think the number was right. I mean, that's pretty impressive. But Todd's a great example of someone that got off oxygen. Carrie Mann at Homestead Out got off his CPAP. It's pretty common.
Yeah, I mean, when I was on oxygen, my oxygen saturation, even on 6 liters, only 88%. And it only took 3 months of carnivore and Wim Hof breathing to get up to 96% without oxygen. So for me, it definitely was pretty quick.
Yeah, but most people on sleep apnea probably have a O2 sat monitor. And if it's recording during the night, you probably know how often your machine is triggering during the night. And you can use that data and work with your sleep doctor, whoever's prescribing it and managing it, and have those discussions with them. I don't recommend you go off of it on your own. I recommend you work with your doctor.
On the CPAP machine, how I found out I was done with it was because when I was getting better, for some reason, I'd wake up and I'd pulled it off my own head in the night. That's why I knew I was done with it, because I kept ripping it off in the night.
Yeah,
I've done that before.
but it's better to do it under supervised care.
For sure. Yeah, I might have just been having a bad dream or something. that was why I decided to do it. Let's see. Question: how long does it take for restless legs to go away after starting carnivore? We are on day 14, and my husband restless legs seems to be getting worse.
Yeah, I don't have an answer for that. I don't know if any of you three do.
I had restless legs, but I mean, honestly, those went away with the anxiety. They seem to be tied to the anxiety. Restless legs went away when the anxiety went away, and that was 3.5 weeks in. So I don't, but I'm sure that's super anecdotal because 3.5 weeks is not a long time.
Yeah, healing in carnivore is so unpredictable. People like to ask the question, how long will it take me? Well, it'll take you as long as it takes you.
That's right.
You are an individual, and you will respond to carnivore on the way that your body heals. And for some people, it took me 4 months to heal metabolic syndrome. It took me probably a month to quit snoring. It took Kerry Mann, I think he said 1 day. I mean, it really, we're so biologically different that we really don't know how much healing we need to do. And I like to focus not on the duration. I like to focus on the hope. I think it's important that you have a hope that you're going to get better and not worry about the time. And now that I'm almost a year out, it's like I have non-scale victories that I didn't anticipate because I didn't know I had an issue. And you begin to see things happen in your body that you don't even anticipate because they've just become so normal and you accept them.
That's a
I
fact.
think there's too much pressure that people put on themselves. And when you put pressure on yourselves, you raise your cortisol, you increase your sympathetic nervous system. And who needs that extra stress? Just eat fatty meats, water, electrolytes if you need it. Enjoy the ride. Let your body heal and see what happens. It's incredible. I mean, look at Lindy's photos. I mean, she's not where she wants to be, but she didn't put a deadline and say, I want to be this by this date. I think that's self-sabotage to do that. And you guys have great attitudes. And I think the better your attitude is, the better you're going to do long term and not put unnecessary pressure on yourself. Just enjoy the ride and get yourself healthy.
For sure. Yeah, that's a huge lesson there, because that is one of the biggest differences this time was, and it's because there's no white knuckling involved. When I was on all the other calorie restrictive diets, the reason why I would always make huge, goals was because how long can you suffer? How long can you endure calorie restriction without nutrition and suffer and keep it up, right? It was all willpower. So of course you're trying to get there because you knew, I don't care who you are, anybody that's doing a calorie restricted diet, you can't keep it up forever. And so you make these unrealistic goals and you are just a stress ball over it because you're just trying to get there before you give in, before you lose your grip on this willpower ride that you're on. But carnivore, I don't have that problem. I don't think a day about anything being hard. I get up and I make awesome smoked prime rib and eat it. Like there's no struggle on carnivore. It's amazing, and that in itself just takes all the worry and the cortisol out of the whole thing, and you do so much better. You sleep better. Every time I sleep good and I'm happy and I'm feeling good, I wake up and I've lost weight. I mean, it's crazy how, it sounds silly, but the better I sleep and the more relaxed I am, the more weight I lose. And that's an absolute correlation.
Yeah, the battle with carnivore is the battle between the 6 inches between your ears.
That's a fact. That's a fact. Some of us have fat heads, so it might be more like 7.5.
be wider than that. Head to Todd. So,
For sure.
I put that Granny Carnivore quote back up there.
Yeah, I loved that. That was
Because
awesome.
we forget it took decades to get there and to love ourselves gently a day at a time. And that's great wisdom, Granny Carnivore. That's exactly the way I feel too. So Carnivore Keith asked about ferritin.
Yeah.
Ferritin is an inflammatory marker. And a lot of carnivores, they start eating carnivore and their ferritin level initially goes up. It's probably because you're taking on you're getting more iron than you're used to, and you probably are releasing some inflammation from your body as you're detoxing, and your ferritin may initially go up, but as it's coming down, that's a sign that you're eliminating inflammation in your body, Keith. So great job.
That's awesome. All right, next. Let's see. Have obstructive sleep apnea. Didn't we already do this one?
No, this is a different one.
No. Okay. On triology machine. No other respiratory problem. A1C 4.8, obese 305 on keto carnivore diet for 3 months. Lost 18 pounds. You think I'll ever get off the triology machine?
I hope so. I sure wouldn't put a time limit on it. I would focus every bit of my hope on doing that. I do think if you have obstructive sleep apnea, though, that you want to make sure you have not only eat carnivore, but you get some activity every day. And Lindy has some great videos talking about rebounding, the vibratory plates.
Vibration plate. Yeah.
Vibration plates are great to get everything moving. And just get out and walk in the sunshine. Get up and walk at sunrise if you can. And just build your tolerance. You may only be able to go half a block when you first start, but just work at it. Get yourself moving. And all of that's going to help. I snored sleeping on my side, could never sleep on my back. Now I don't snore in any position. I don't snore when I lie on my back or when I sleep on my side. It's pretty amazing. And I've never been diagnosed with sleep apnea, but I certainly was a snorer.
Awesome.
But great hemoglobin A1C.
Yeah, 4.8. That's
Susan says she was diagnosed with
severe.
OSA and on CPAP since 16, started keto in 18, carnivore 23. No longer use my CPAP. Congratulations, Susan.
That's
I have 8
awesome.
years to lose. And that's so typical. People think they have to get down to normal weight to lose the obstructive sleep apnea, but that is far from the truth. You may have to for your particular case, but there's a lot of people that just reduce inflammation in their body. And,
Yeah, I'm still over 400 pounds, and I haven't used the CPAP in 2 months, 3 months.
Yeah.
Todd, how much weight have you lost? Right. Depends on where I started. I estimate that I started at 715, but I don't actually know that number. But right around 300 pounds, give or take 20 pounds right now.
And that's over what period of time, Todd?
19 months now.
Wow.
Yeah, and and honestly, it's been the easiest weight I've ever lost in my life.
Yeah, and I think about what is 19 months. I mean, a little over a year and a half. And I'm not sure you would have been alive 19 months later if you had not made a change.
This was the first year that fireworks that it was kind of crazy, right? Because I meet a lot of people that only see me once a year come to fireworks, and last year they noticed a difference when they're here because last year's 12 out of the 19 months go. But this year it was like shock on their face. People were coming, and that I wasn't ready for. People were like, because now that they see me, they're opening up saying, "I thought you were going to die." Everybody was saying, I didn't think like they didn't know if they're going to see me this year. And that was, dozens and dozens of people they came around. And then what the other funny thing was, just like I've been saying, I'm hoping that just the weight loss is going to be enough to be an example that people are going to ask about. And sure enough, there's over 7 or 8 people this year that came up to me and want to try carnivore just because they saw me dying, and now they see me not dying. So yeah, I don't think I would have been here either. I honestly don't.
Yeah, it's pretty amazing. So Susan asked, am I a carnivore, ketovore, or keto? I'm a carnivore, strict carnivore, and
I'm happy every day. Carnivore
so
diet.
this is interesting. Lou Gehrig's disease, or amyotrophic lateral sclerosis, is a demyelinating disease, like multiple sclerosis is a demyelinating disease. And the myelin is the nerve sheath that's made up of a lot of cholesterol. And we don't know why people get ALS. It's a degenerative condition. So the question, will it help ALS? It certainly won't hurt ALS. Could it help? Theoretically, we're seeing people with Parkinsonism and multiple sclerosis both having remissions on carnivore. The question with ALS is, will your nerves regenerate with time? I don't have an answer for you. I don't think there's enough. You're the N equals 1 person, until we have evidence. So I think, Mia, you should be the one to go out there and show that strict carnivore will reverse ALS, because we need that information in the literature. And we know that eating fatty meats helps the myelination of your nerves over time. Your body needs cholesterol, and people in the Western world have been starving ourselves of fatty acids and cholesterol for several decades. And we're seeing more ALS and multiple sclerosis and other neuropathies, peripheral neuropathies occurring. And I'm sure it's related to our diet. There's probably a genetic effect, predisposition for ALS, but there's a lot of genetic predispositions for things. And certainly if I had ALS, I would not expect to get ALS being a carnivore as strict as I am, but I would certainly go full carnivore and never cheat. But you're in a race against time. You don't have time to wait around and say, well, maybe I'll do it tomorrow, or maybe I'll do it in a month, or maybe I'll do it in a year. Every day that you slip is a day of your life that you're giving up. And no one knows the definitive answer to your question, Mia. But again, I can't think of anything harmful it would do to you. I can only think of the potential benefit of it. But you're going to be the person that has to determine that for yourself. You're the person that knows every day how you're doing. And are you getting worse or getting better? And, it's really hard with MS. ALS is more of a linear progressive disease. MS is more of a remission, flares, remission, flare, remission, flare. And I would say you're going to be a better guide with ALS than even someone with MS, because people with MS can have unexplained remissions for months to weeks to days, and not know why. But we're seeing way too many people getting out of wheelchairs with MS, and I don't see any reason why I would not. I would hope that the ALS would respond. So that would be my hope for you, but don't have any research or data to support that. Just my gut.
Awesome. All right. Gayla asks, a naturopath told me a Alistar I don't know what that is, xanthan to reduce my CRP inflammation. Does the doctor know anything about this supplement?
No, don't know a thing. And why would I use a supplement if I can reduce it by eating fatty meats and water?
There you go. Good answer.
I'm kind of a spendthrift. I don't like to take a bunch of stuff. If I can change my habits and my diet and heal things, I'd rather use my God-given natural abilities to heal than to try to take some artificial laboratory stuff to think that that's going to be good.
Let's see here. Doctor, do you know if carnivore can help with DVT?
So I would say that DVTs are related to risk factors being trauma, being cancer, being inflammation. Once you have a DVT, what we try to do is we put you on an anticoagulant or blood thinner to keep, and it's not to dissolve the DVT. We are doing it so that the blood clot doesn't grow bigger. So most people think that they're put on blood thinner to dissolve the clot, and that's not true. You're put on a blood thinner so the clot doesn't get bigger and grow and break loose and go to your lungs and kill you. And because if a blood clot goes to your lungs, 20% of people don't survive that, 1 in 5. So if you have a DVT or you're prone to DVTs, you would want to do everything you can to reduce inflammation. You still want to take the anticoagulant for the length of time prescribed for your circumstance. But think about inflammation as one of the major risk factors for DVT. You can't, and I've seen like cyclists get hit in the back of the calf with their pedal when their foot slipped off and the pedal hit the back, and they developed a blood clot in their calf. And the question is that trauma alone, or is it trauma plus inflammation? And so I don't think anyone knows the answer to that. But if you have a DVT, you definitely want to take a blood thinner to prevent it from progressing. But getting inflammation out of your body is definitely part of your long-term treatment plan so that you aren't prone to get more DVT, and it'll only supplement what you're doing. But remember, if you're on Coumadin, which is oral anticoagulant that we've been using, changing your diet can change the levels of your vitamin K and can affect your Coumadin levels, which is measured with a blood test. So called the PT, or prothrombin time. And so if you're new to carnivore and you're just starting carnivore and you're on Coumadin or warfarin, which is the generic name for it. I don't know what it's called in down under, Lindy, but warfarin.
I've heard of warfarin. I think
Okay,
we call it that too. Yeah.
Yeah, and warfarin is also the active ingredients in decon rat killer. So I always told my patients, I'm going to put you on rat poison to treat your DVT, but we're really not treating the DVT. We're trying to prevent complications from the DVT. So
Wow. I heard that was what, because my mom and brother, one of the things I think got my brother sick was Diet Coke. They both drank tons and tons of Diet Coke, and they said that a bunch of the Gulf War syndrome was actually the diet soda that they were leaving in the desert out in the sun, because when you heat aspartame, it goes back to like its unaltered chemical state or something that was wood alcohol and formaldehyde. And they did studies on it, and they said that's the same stuff as the decon rat poison. Is that true?
No, that wouldn't be the same thing. It's basically embalming fluid.
Embalming fluid. Oh, great. Okay, great. So they were, I guess.
Either way, it's not good for you.
No.
Yeah, I wouldn't even think about that. Isn't that weird?
Yeah, they said that's a lot of what's been happening the diet soda because when it gets shipped in those semis and the semis stay out in the sun, they're not refrigerated. And if it gets over like 130 degrees in the semi or something, it'll break down the aspartame and it goes to a rested chemical state. It's no longer bonded, and it's wood alcohol and formaldehyde.
Oh, great. Well, wood alcohol can make you blind too. So
Perfect.
it's kind of a double whammy. So
this is kind of a shout out on day 7 of Carnivore, down 11 pounds. I am amazed. I am a believer. Feel amazing mentally. Knees pain was a 10 out of 10. Now it's 4 out of 10. Congratulations.
Big difference. It's awesome.
great job.
Great.
Applaud.
Yes.
Absolutely. Let's see, Chris. Question: in all casing that you've seen, people with RA, have they completely reversed their RA symptoms? And if not, and if it's not going away, does that mean they're not full carnivore?
Yeah, great question. So let's frame that a little different. If your autoimmune disease is not going away, does that mean you're not strict enough carnivore? And only you can answer that. But let's go back to my earlier answer that you don't know how long it's going to take you to heal condition X that you have. But you are the only person that knows how strict you are. And not everyone is as sensitive as Michaela Peterson, Jordan Peterson's daughter, who literally gets symptoms immediately if she eats the wrong thing. Where she literally can eat something and her joints swell and she can't walk or whatever. So I would say, I wouldn't say I'm not full carnivore and my RA hasn't gone away. And I'm not sure that everybody's RA will go away because there may be other factors other than diet that may be putting you at risk for RA. You may have environmental toxins that you don't know about. You could have mold issues. You could have all kinds of environmental things. But diet is something that you have total control over. And so this way of eating is the best chance you have. And if there's things to get rid of in your diet, I really recommend, if you have autoimmune diseases, to start with eliminating anything that may be playing a factor, and then only reintroducing things one at a time for a week to see if you have any flare-up of symptoms. And my dad, who's going to be 95 in about 6 weeks, he had a lot of health issues, and I got him to go carnivore for 60 days, and then we reintroduced one fruit or one vegetable a week. And he totally he had polymyalgia rheumatica, had been on 20 years of prednisone every day. And he's been off prednisone now since January. And he's dropped 70 pounds. But when he ate onions, which he loved to eat, he reintroduced onions. Literally that day, his PMR, polymyalgia rheumatica, which manifests itself by bilateral shoulder pain and stiffness in his neck, came back immediately. And we had to give 3 days of prednisone at 10 milligrams a day to put it back in remission and get him off onions. And now he avoids everything of the onion family. So that's onions, shallots, garlic, carrots. So
Dr. Chafee's right. The plants are trying to kill us.
Yeah, some plants are trying to kill us. And he was a fanatic for onions. I don't think he ever had a meal that he didn't have onions.
Oh,
Wow.
He buys Vidalian onions at Sam's Clubs in the big 20-pound bag, and he would hollow out a Vidalia onion and put a bouillon cube in the middle of it and microwave it for 7 minutes, and it'd make a bouillon impregnated onion, and he would eat that as his vegetable. And he ate onions all the time, and he had no idea that that's why he couldn't get off the prednisone.
That's so crazy.
So I tell the story and my wife, she literally gets swollen knuckles in her hands immediately when she eats something that she reacts to. And it can be flour, it can be sugar. And she's not even carnivore. She's just no processed foods and kind of dirty keto, but she does really well. But she's eating no processed food, no sugar, no flour. And she feels amazingly better. So,
yeah, I gotta say, I used to hear people say stuff like that, and I went, people got to be kind of exaggerating, right? One onion, one whatever. And when we went to Texas, I went to In-N-Out Burger, and I got a Flying Dutchman. I got 3 of them that was wrapped in lettuce, and I thought, I was driving in the car, and I didn't want to get my hands greasy and touch the steering wheel. I thought, I'll eat the lettuce. My knee legitimately swelled up after that day for 3 days.
yeah.
I hadn't had knee pain, since I started carnivore, and my knee swelled up for 3 days. I was limping. Lindy saw me limping around from that stupid lettuce wrap. I was like, oh, this is 100% real.
Well, you almost have to be thankful for Robin Harrell says her eczema flares immediately if she eats the wrong thing. And, people that get gout, eczema, acne, your body will tell you if you're eating something that you shouldn't, if it has gone away, and then when you reintroduce it, it comes right back.
Yeah.
And the question is, at some point you got to make a decision, because every time you have an eczema flare, the next one's going to be harder to get rid of. The next one's going to be harder to get rid of. The next one's going to be hard. So why keep challenging your body with something that your body's telling you, stop, quit doing it to me,
Well, and especially for like an onion or lettuce, like if we were having this conversation about ribeye or bacon, we might go to blows. But if you're going to have this conversation about lettuce and onions, I can give up lettuce and onions to not have inflammation and.
Yeah, and it's the old doctor joke about why did the masochist stay married to the sadist, and the answer is beats me. It's a sick joke, but why do we beat ourselves up with something that we know? And it sometimes takes us a while to figure out what that thing is. But once we know it, we just have to put it on the do not use list. And if you have to put skull and crossbones labels, the Jolly Rogers on the foods that are killing you, you need to do that.
Yeah. Well, and that's very true. That is why I'm not, people say, are you going to have a treat day for your birthday and have cake? I'm like, I don't consider poisoning myself and being miserable for a week a treat. So no, I'm not, I'm not going to do that. If you change that what we call a treat and said, are you going to have some meth for your birthday because you're going to celebrate? I'd be like, no, I'm not having meth today because it's my birthday. That's why I literally think of sugar now.
Yeah, and most people have a totally wrong idea of addiction. We know from the Vietnam War that 90% of the servicemen had some heroin when they were over in Southeast Asia. It was rampant. And when they came back to the United States, they didn't continue being heroin addicts. They basically didn't have access to heroin, and they just quit cold turkey, and they all did fine. And less than 1 in 10 actually had to go through a detox process. And we think that, we got to do all this detoxing. No, you just need to take away the poison and quit taking the poison. Yes, if you have an addictive personality, you may need further help, but 90% of people do not have an addictive personality, and you just need to quit it, stop it, quit doing it.
And even more so, I definitely did have an addictive personality, but I swear on anything right now, I no longer have that personality, and it was directly related, I think, to when the anxiety went away. When the anxiety went away, so did my addictive personality. It's just gone.
Yeah. And I would say as the inflammation goes away and the sleep apnea goes away, the anxiety goes away.
Yeah.
And we're going to talk in a little bit about the whole tryptophan serotonin level. We'll talk about that. But put sign of question up there, Michael.
Okay. The other one?
And then you had another one before that. So Sonia Varner asks, do spices have the same effect as eating whole food? No, not really. Spices are typically in minute amounts, and you have to, again, decide, is that causing me any problems or not? Personally, I like to I have about 3 dishes that I use spices on. My braised pork belly, which I put herb de Provence on, which is a mixture of lavender and a couple of other things. It's a French spice. And but you have to test these things for yourself and see how you do on it. But often, if you're having palate fatigue or meat aversion, spices may be the quickest way to get you back on track by changing the food. But you're the one that needs to make sure that when you add spices back in, you're not having any adverse effects of it, because we're all different. But in most cases, most people won't if we're talking trace amounts. And so many bottled spices now have brown sugar added to them, or dextrose or maltose. And you just got to read the labels. And the best spices you can get are the ones that you make yourself, or the ones that you read the labels very carefully.
Yeah, I like to buy 1 ingredient spices. So the spice is just freeze dried. That's it.
Yeah.
Those are the ones that I get. And even then, I take them one at a time and I see what they do to me. Like if that's how I found out black pepper, I'm terrible. Whatever. I don't know if I'm allergic or if I just have some sort of inflammation response. Black pepper tears me up. The other one that I found out I can't do is chives. I don't know what's in chives, but chives will light me up. Something terrible.
Well, chives is in the onion family, and I don't use onion salt or garlic salt simply because of my dad's experience. And a lot of times we'll have him over for dinner, and I just won't put onion salt or garlic salt or garlic powder or onion powder in things because I don't want to run the risk of him going back into the PMR and having to be back on prednisone, because the prednisone caused him to balloon up in weight. It gave him osteopenia. It gave him the big cushingoid gut, weakness in his legs. I mean, he just had and metabolic syndrome. So,
do you think that you find, because my theory has been the freeze-dried ones, you still got to be careful with them, but the freeze-dried ones seem to do a little bit better. The 1 ingredient freeze-dried ones, I had the least amount of problems with all those, like out of everything, because just like you said, I don't trust all the fillers and the mixes and stuff. Yeah. But then also, I've had a few fermented. I use some fermented foods like sauerkraut and pickled jalapenos, kind of like a spice almost. It's just kind of something to add a little bit of flavor. But every time, I've never had a problem with something pickled as long as they didn't add sugar to it.
Yeah.
And they said that kind of dilutes the oxalates or whatever, but I don't know. But I've had really good luck with that myself.
I know you eat a lot of pickled jalapenos.
I do.
18 egg omelets every day with your pickled jalapenos. So again, you need to test for yourself and find out what your body can take.
Sure.
We had an earlier question, Michael, from someone about osteoporosis.
Let's see.
Before we get to skin issues. Anyway, someone asked, does carnivore help osteoporosis? Absolutely. Most people are focused on calcium with osteoporosis and osteopenia. So the difference between osteopenia, which is weakened bones, and osteoporosis means severely weakened bones at risk for fractures and possibly have already had fractures. Most people don't know that your bone structure is a protein matrix with calcium molecules that are suspended in it. And long before your calcium goes to pot, your protein is a major issue. And so as you eat more and more fatty meats, there are several things in play. One is if you're taking calcium supplements and don't have adequate K2, which is vitamin K2, or D3, which is vitamin D, and you're taking calcium, but you're not full of protein, you don't have adequate protein intake, you're really not going to add that calcium to your bones because you need the protein matrix for the calcium to add to. And that calcium can actually cause deposits in your arteries and lead to coronary artery calcifications and raise your CAC score. And so you eat egg yolks, you eat salmon, you eat things, liver, things that are increase your K2. You get sunlight to get your D3 if you live somewhere where you can't get the sunlight, like in Seattle, Washington, or Minnesota. You probably should be taking D3. I live in Florida, and there's times in the year I don't get out enough. Now I get out regularly to get my D3, but I became D3 deficient when I was automating hospitals across the country because I'd literally go into the hospital in the dark and leave in the dark, and would spend all day and got vitamin D deficient. But now, I get out every day and walk in the sun, and it helps me. So I don't take K2 supplements. Cranky Carnivore Cutler is asking, should I be supplementing with K2? I would be supplementing with K2 rich foods, especially egg yolks and salmon, sardines, anything that you need to take to get it. And if you need to supplement short time, K2 kind of gets expensive, and you normally buy K2 with D3 together. And if you have to take it for a month or two to bridge or get a 90-day supply, that's certainly fine. But long term, include the higher rich foods in your diet that will get you the K2 so that the calcium can be properly absorbed and go to where you need it, which is on your bones and not to your arteries. But there's too many people that are taking high doses of calcium, and those are actually causing calcidosis, calcium deposits in their body that aren't really helping them. Now, Nancy says she was just diagnosed with osteoporosis and she had a parathyroid tumor. So she has hyperparathyroidism, which is pretty rare, which impacts your calcium and your phosphorus metabolism. So that's a totally separate issue where you have to take care of the parathyroid tumor.
I just recognized a comment here. Can we answer this one? I know it's not related, but she's messaged me a few times in my chat, and she's having an issue with iron, and she was wanting to ask you if I can't absorb iron. I've been off antacids for 2 months. Will my stomach heal?
Yeah, you do need eating fatty meats, especially red meats, will help to rebuild your iron stores the best of anything, especially the rarer you get it. And I find the longer I'm carnivore, the redder I like my meat, the rarer I like the meat. So as long as you're not losing the iron faster than you're getting it, and some women have abnormal periods or excessive periods, uterine fibroids, other things that are causing them to lose iron. But you should be able to rebuild your iron eating carnivore over time. But you got to realize that things that are called iron-rich vegetables, like spinach, actually those aren't very bioavailable iron sources, and so you're really not absorbing much. And iron is difficult to absorb anyway, and so eating as part of a carnivore way of eating is the best way to get your iron built back up again.
I got you. Let's
Okay.
see.
I think there was a question from Tim.
Oh, from Tim?
Yeah, about inflammation. I want to make sure we answer that.
Yeah, absolutely. You see one from Tim, Michael? It's not in the star questions.
So, meanwhile, Kimberly W says, I was wondering if eczema and psoriasis are caused from inflammation. If not, what are the causes for it? Well, we don't know exactly what the cause of, but we do know reducing inflammation may put your eczema and psoriasis into remission. So, is that cause and effect? I don't know. I have just seen so many carnivores reverse psoriasis and eczema with the carnivore way of eating. Um, so that I would definitely, eczema and psoriasis are two good excuses for the carnivore way of eating. But whether it's a cause, your plant-based diet is a cause or not, I'm not going to take that effect because again, there's hereditary factors, there's environmental factors, there's sunlight factors, there's bathing habits. Eczema definitely gets worse in people that bathe a lot, especially if they're bathing 2 or 3 times a day. But carnivore way of eating tends to reverse both eczema and psoriasis. So I wouldn't worry too much about the cause. I would look at the effect and think about, will I reverse it at some point? You should see improvement. We get rid of it altogether? I don't know, because I don't know what the ultimate cause is.
Thanks. Did you find one from Tim, Michael?
Yes, I did.
Go ahead.
What causes inflammation? Okay, great question. So, first off, inflammation is really a normal process. It was developed by the body, and inflammation is actually a good thing. So let's say you have a splinter in your skin, in your thumb. Okay, so we have a splinter in your thumb. The body sends white blood cells into that area, which produces inflammatory chemicals that are released by the white blood cells. And these are the degranulating white blood cells, your macrophages, and any of your cells that can degranulate, and they reduce chemicals into the tissue. And the whole idea is inflammation causes heat, which increases the circulation in the area, causes pain because of the swelling, causes swelling. And that swelling, and it has a bactericidal effect, meaning killing bacteria to sterilize the area. So it's doing everything it can to this foreign invader, whether it be a bacterium or a splinter or a virus, and it's trying to expel the invader from your tissue. So the swelling and the chemicals are all trying to push the splinter out or kill the bacteria or do ever what inflammation is geared to do. And so you'll see that a lot of these drugs that they're giving now as immune modulating disease drugs, they're giving for inflammatory bowel disease, they're giving for psoriatic arthritis, psoriasis. You'll notice that they say there may be an increase in infections, in TB, in leukemia, and death. Well, that's because when you modulate the immune response, the inflammatory response artificially, turning off a very important function that's your first line of defense against foreign invaders. And if the inflammatory system can allow to do its thing, it's to bring you in health. But when it's in overdrive and overstimulated because of what we're doing, because we're feeding ourselves wrong, or we're insulting our bodies wrong, or we're in high stress areas and we're driving our adrenal glands with high levels of cortisol, or we're doing excessive whatever, we're driving that inflammatory condition until it becomes unmanageable to the point that you can start producing actual antibodies to the foreign invader. And in this case, the foreign invader is your own body. because your own body is perpetuating and magnifying the inflammation. And that's when you begin to get the various autoimmune diseases. And if you're making inflammation against your antibodies against your synovium or lining of your joints, that's rheumatoid arthritis. If you're making it against the skin, that's psoriasis. If you're making it against your DNA, that's systemic lupus erythematosus, which then affects every organ of the body. If you're making it against lung tissue, that's a pneumonitis, such as Wagner's granulomatosis or chemical pneumonitis or a whole sarcoidosis, all these inflammatory things. So inflammation is a God-given ability that we have in our body that is never mentioned, is never intended to be prolonged and hyperstimulated. But we're hyperstimulating it with our way of eating, when we're eating the standard American diet, when we're eating GMO, when we're eating all these pesticides and organophosphates and the glycosates and all the stuff that our body's not intended to consume. You're overdriving the inflammatory process. And what do? We try to turn down the inflammatory process with aspirin, with nonsteroidals, with prednisone, and with these very, very expensive immune modulating drugs. And there's a lot of profit to be made in these. But ultimately, the inflammation is telling you that something's not right. Take care of the things that's not right so the body's inflammation will heal. So that's kind of a simplified version, but I hope that's in a way that most people can understand. So if people can comment in the comments, does that make sense to people that inflammation is not a bad thing? Prolonged hyperstimulated inflammation is a bad thing.
Before I started Carnivore, I went to the doctors, had a blood panel, and she told me that my inflammation markers were the highest she's ever seen before. Wanted me to do a whole bunch of scans, a liver scan, kidney scan, like everything. And I just said no. Back then, at nearly 800 pounds, I was embarrassed. I didn't think I'd fit in any equipment. I didn't want people, poking and prodding me. And I just said, I'm going to start Carnivore. Give me 3 months, and whatever. If that doesn't work and things go bad, I'll do whatever you say. And when I went back, did another blood panel, and everything was fine. My inflammation markers had gone down. I'd lost a lot of edema, a lot of fluid in my body, and just my recent blood scans still perfect. So just changing my diet was enough to get those inflammation markers back to normal in such a quick time. Just carnivore diet, strict.
You saved your life, and yet you have idiots out there that will tell you, oh, you're eating fatty meats, you're eating too much saturated fat, it's going to kill you, it's going to give you a heart attack. Inflammation gives you a heart attack. You're more at risk with having an elevated CRP, C-reactive protein, than you are from an LDL cholesterol if your HDL and triglycerides are normal. So,
and the doctors continue to tell me that I need to add vegetables and add this and that to my diet.
Sure.
And I'm like, I mentioned something to Dr. Chafe, and he's like, why fix something that ain't broke? Well, I ain't broke now. So I'm staying carnivore. I don't want to add anything else at the moment. Like everything's, my blood glucose levels, everything is perfect. Why should I change? So I don't listen to my doctor, unfortunately. Like if I did have problems, obviously I would, but nothing's wrong. Oh, and she agrees my markers are great. So why would I need to change stuff? Yeah. Stay with what you're doing.
Like I said, you're an inspiration.
Thank you.
100%. That's why I'm here. Let's see. If someone is dealing with RA and also a statin, when should they know it's the right time to lean off of the medication or remove it?
Yeah, great question. And I think anything that you're taking chronically, you really need to work with your doctor and know how to ask that, because that's an individual question. You need to know what's right for you. Some things are more urgent than others. And we have this static noise that I hear. Is that coming from me or someone else?
I don't hear it. You hear it, Michael?
Okay.
Yeah, I do too. I hear it.
Now?
So anyway, it went away. So it's gone. So
Okay.
there are certain meds. Yeah, it's back again. There, it went away again.
Yeah.
Okay, so it's all Michael said. Okay. So there are certain meds that you never want to wean on your own because you can't necessarily measure what you're doing. And diabetic meds, you can monitor your blood sugar, you can do a CGM, but a lot of people are on 3, 4, or 5 diabetic meds. And you really need to find a doctor who's going to work with you if you're going to get off diabetic meds. Same thing with your rheumatologist who's managing your rheumatoid arthritis. You should all the time be thinking about, can I have a drug holiday and see what happens? The word is not come off the meds. Ask them if you can do a drug holiday and see what happens. So sometimes it's just, how do I talk to my doctor to get my doctor on my team rather than on my doctor's team? And I couldn't believe when I went to my dad's rheumatology appointment and we had him off prednisone. And the rheumatologist, so he's treated him for 20 plus years, had him on prednisone every day of his life. And the rheumatologist said, oh, I wouldn't restrict his diet. He's 94 years old. If he has to take prednisone the rest of his life, what's the big deal? I said, the big deal is you're killing him. He's getting diabetes, getting hypertension. He's 70 pounds overweight. He's reversed all that. Why would you ever say that to a patient? He said, well, your dad is an inspiration. He's the only person in my practice that ever got better.
That says it all. That says it all right there.
And my dad and the doctor said, so are you going to have 100-day birthday celebration for your dad? And he said, will you invite me? And my dad said, I hope you're still around for it. Which I thought was the ultimate answer. I hope you're still around for it, Doc.
Right. 100%.
I love it.
He's listening to his own information.
But
100%.
I didn't tell him to change rheumatologists. I just said, Dad, that didn't even make sense to me. And he's so happy to be off the prednisone, but he loves his rheumatologist. And we'll continue to work with the rheumatologist in case we ever need him, because he may have flare-ups. But he just did a 3,000-mile drive for 6 weeks, went from Florida all the way up to Ohio and Indiana, and went to Dollywood and went to Branson and caught shows. And, he traveled 3,260 miles by himself over 6 weeks and didn't have any flare-up of PMR, which is the first time in 2 decades that he's been able to do that. And, why would you go back to doing? And it just makes me sick that someone would say, well, just eat whatever and take prednisone. It just makes no sense to me. Now, statins are a tricky wicket. The question is, do you still need a statin? And again, statins are something that could be causing glucose intolerance, could be causing insulin resistance, could be causing diabetes, could be causing myositis, which is deterioration of your muscles. And the other thing is your age. My dad was still on a statin, and he was in his early 90s. And I went to his primary care doctor and said, what the heck is a 90-year-old doing on a statin? he said, well, you know what it's like. You start these meds and you never reassess whether they still need them. But there is no indication to give a statin to anyone never over the age of 80. There is no indication to give it over the age of 80. It's questionable you give it over the age of 70, and it's doubtful. You probably have to treat 200 people in their 60s to prevent one heart attack. So you've got, those 200 people you treat, 40% of those will have serious side effects of it and the cost. So, but you have to look individually of whether or not you still need the statin. And we talk regularly, but again, don't stop a medicine because of something I said. Work with your doctor and question, is it time, can we do a drug holiday? And do one at a time. Don't go stop a bunch of meds. That makes no sense. Now, your blood pressure, if your blood pressure is low and you're on medicine, tell your doctor, look, call the nurse and say, look, I'm starting to have low blood pressure. I've lost weight. I'm going to cut my pill in half if you can. Some pills can't be cut in half. I want to eliminate one med. Is that okay? Wait to hear back from them. Do it with their knowledge. But you can monitor your blood pressure at home. That's something you can easily monitor, like you can your blood sugar. But it's tricky getting off some of these diabetic meds. And if you're on 4 or 5 meds, what are the first ones to get rid of? That has to be individualized for you but even type 1 diabetics require less insulin. People requiring insulin require less insulin when they're on carnivore. And we have someone in Steak and Butter Gang who's a type 1 diabetic her insulin needs have gone down dramatically on carnivore. So, but the goal of type 2 diabetes in the British study where they did with primary care clinics, 90% of people that had diabetes less than a year came off all meds within a year. And 50% of the people that had diabetes longer than 6 years came off their meds within a year. So diabetes can be put in remission and possibly healed, especially type 2 diabetes.
Yeah. I mean, have you ever seen anybody that's done carnivore for any length of time, even like 6 months, that didn't improve it? I have.
Well, again, what if it takes a year? What if it takes 2 years to get off your diabetes? I really don't care. I know that your body's going to heal. So just stick with it. But don't say, well, I do 80% of carnivore, or I do 20% ketovore, or I'm doing keto, but I have 5 desserts a day. I mean, don't kid yourself. I call it the 11th commandment. The 11th commandment is don't jive thyself.
I like that.
Don't lie to yourself.
Yeah.
You have to know what to do. So why can't people have pacemakers use a vibration plate? Do you know the answer to that question, Lindy?
I don't actually. No. I know people that have any kind of metallic devices in them shouldn't be using it. If you've had a knee replacement, things like that. They recommend you don't use a vibration plate. But I always tell people to talk to their doctor. They'd be the best person to advise whether you should or shouldn't use the vibration plate.
Well, if you think about it, electronic equipment submitted to the stress of high vibration.
Right.
That's not a good idea.
That's what I would guess. When we hook up any piece of equipment, when we hook it up electrically that has vibration, it has to have a vibration dampener or a flexible, metal conduit, because it'll shake it loose. That's what I was thinking. It's not a good idea to shake an electronic piece of equipment for.
And I would go with rebounding. Rebounding doesn't create the high frequency vibration that a vibration plate does, Pam. So you can do a lot with a rebounder, even if you're sitting and just using it to work your legs. And if you've never done it before, get one probably with a guardrail on it.
Yes, that's something I didn't buy, was the guardrail. I'm like, I don't need that. I do. It's on my wish list is to get myself a guardrail.
Not used to rebounding. So vibration is not good for a pacemaker or any as Todd said, anything that's loose in the body.
So even if you're sitting down and just using it on your legs, that's not a good idea as well? Or just
The
standing on a
vibration
vibration plate? Yeah.
No, yeah, vibration transmits through your body. So
Okay.
a vibration plate is a high energy device, and so you're going to transmit some of that vibration.
Fair enough.
So I'm sure they're all labeled not to do it, and I'm sure the companies don't want the liability of you doing it.
I need to check and see if anybody's done any studies on. I have a greenfield filter installed.
Yeah, greenfield filter is a little different. That's a wire cage that's in your vena cava.
Mm-hmm.
And if you've had it more than 6 months, it's epithelialized, and that's unlikely to move.
Yeah, it's been in there for probably 20 years now.
Yeah, so that's part of you now, Michael. So you had DVTs too, huh? Pulmonary emboli?
Well, I had a surgery, and they were worried that that was going to happen, so they wanted to get it in there when they installed it during surgery.
Yeah. Okay. Yeah, when they first put those in, those were at risk for moving.
Mm-hmm.
But once they're epithelialized, which happens weeks to months after they're put in,
Right.
they're going to be pretty safe. Rom 1778 asked, did priming make a big difference for me? It made all the difference for me. I was a chronic undereater. I had gone on a protein-sparing modified fast in 2016, trying to get rid of the 75 pounds I gained after my heart infection. And I took all the weight off, but gained it right back again. And did carnivore, lost about 15 pounds on carnivore pretty easily, and then just kind of stalled. And I really need a priming to get my metabolism reset. And I went to Steak and Butter Gang specifically to prime and learn how to do it and learn how to do their nourished fasting. And I'm a big fan of priming. I think it made all the difference in the world to me. And I don't worry about how much I eat now, but I was definitely under eating on carnivore. I just didn't have much appetite. And when I primed, I just became a ravenous pig. I just ate so much. I can chow down on 2 ribeyes easy now. And I could barely do a 16-ounce ribeye as my one meal a day before I primed. And
I gotta tell you, me and Max and Bella went out to dinner here at a steakhouse night before last, I guess. And the waitress was very confused when we ordered 6 dinners between the 3 of us. It actually seemed to almost enrage her because she seriously looked at us like we were making a joke or something. And she goes, "Is some of this to go? Do you want it in to go boxes?" We're like, "No, it's for here." And she was visibly irritated.
I would love Bella to go to one of those 64-ounce steak challenges where if you finish the steak, you get it for free.
Did you guys see my interview where I interviewed the Wyoming, what's his name? Tyler McCann?
Oh, I did not.
Okay, so Tyler McCann is the host of the Wyoming event we're all going to in August.
Okay.
That is for the Rendezvous City Meat Roundup.
Yeah.
And we're all going there. And I said, he was telling me about all the events. I said, "You're missing the boat, Tyler." Because I said, you need to organize the old 96er, bring the old 96er from the Great Outdoors back where John Candy had to eat the 96-ounce steak. You remember that in the Great Outdoors movie? So anyhow, he said he wasn't sure he's going to have time for this year, but he said by next year he'll have the old 96er be a part of the Rendezvous City Roundup. So
well, Bella is so petite, and for her to order 2 meals and to chow down is just incredible.
Oh yeah. She was taking them down. She was taking down, no joke. I cut these rib roasts. We cooked like 4 or 5 of them over the 3 days she was here. I would, and those rib steaks were like that, and I would cut them that thick, and she'd eat 2 of them, no problem each time. Like take it down like 4 pounds of meat, like no problem at all.
So Miguel Souza says his cardiologist kept insisting he took statins, so he fired him. I actually converted my cardiologist. He thought I was killing myself, and he's totally on my side now. So I took some articles in, Dr. Barry videos, sent him my video interview. And Miguel, if you haven't seen my interview on YouTube with Steak and Butter Gal from about 6 weeks ago, watch that and then send it to your cardiologist. Maybe he'll change his mind, because it's hard to find a good cardiologist, and I did not want to give up my cardiologist. But I'll tell you, the day I went in to have that conversation, and I'm talking doctor to doctor, my BP was like 140/96 that day in the office, and I never have high blood pressure. But just going and having the confrontation with my doctor as a doctor was anxiety producing.
Well, that brings up a good question here too that I was gonna bring up, because that's right in there. Just lack of sleep, and I was gonna ask that, and also like anxiety. I think that causes inflammation.
I think definitely your sleep pattern is a problem with getting your circadian rhythms off, and anything that's driving excess cortisol in your body is going to impact, let's say, your inflammation. And I think that getting sleep regulated is really hard for a lot of people in Western society, because we have variable schedules and we allow ourselves to do things. And I think, and I'm a guy who most of my life slept 5 hours a night and functioned like that. So I would do the 80-hour weeks, week after week after week after week. And now my sleep is much healthier now that I'm on the carnivore way of eating. I still have some days I sleep 6 hours, but I have a lot of days I sleep 7, 8 hours and feel great when I wake up. But it's hard to get ourselves regulated, to have a set bedtime, to cut off all the stimulation at bedtime. And it's just almost impossible for me to do. I'm watching my grandkids for the last 3 weeks, and you have to be very flexible if you're pseudo parent or parent.
Sure. John was giving me a compliment. He said, I just watched a short by Dr. Ken Berry about inflammation. It was brief. You just explained it in an easy and understandable way on his explanation. That's awesome.
Yeah, thank you, Cranky Carnivore. And, there's so many inflammatory markers that we measure. I talked about tumor necrosis factor and interleukin-6, which are two. Ferritin we talked about, but C-reactive protein, especially the cardiac highly sensitive CRP, the ESR, which is the erythrocyte sedimentation rate, which is the cheapest one to do. That's the one that's elevated in PMR. That's the only one that's elevated in PMR. And if you have lupus, you have all kinds of anti-DNA factors. Rheumatoid arthritis has a rheumatoid factor, which is an inflammatory marker. There's even an anti-mitochondrial antibody that isn't in common usage yet. It's still in the experimental phase. But if you're high in the anti-mitochondrial inflammation marker, your risk of having a heart attack in the next year is like 100 times higher. I mean, it's incredible. In our mitochondria, the mitochondrial research is what Dr. Thiefried talks about all the time in the cancer research about healing the mitochondria, and how that's progenitor for cancers. Most cancers have diseased mitochondria in them. So pretty crazy stuff.
That's awesome. Let's see. Life Max 305. My husband has AFib, and typical would get an episode every 3 months, lasting a few days. On Carnivore 3 months now, and he is having episodes weekly.
Yeah, that's very atypical. I would really be concerned about magnesium deficiency. Sodium, potassium, and magnesium are all part of your cardiac arrhythmia electrolytes. And after the COVID 2-shot initial inoculation, I had AFib within 2 weeks for the first time. And I had 2 episodes within a month, and I haven't had any more since. And for me, I was pretty convinced that my heart needed more magnesium, because magnesium stabilizes the membranes, and to make sure you're getting enough potassium and sodium. So I would probably take an electrolyte for a while, but if you're really depleted in magnesium, which I thought I was, I went ahead and signed up for float spas, which are Epsom salt spas. We have them in Tampa. It's called Tampa Floats. And it's actually a sensory deprivation pod that has 1,100 pounds of about half a ton of Epsom salt in it. And you go in it for an hour and you basically float. And you can, I turn the lights off and close the lid. So I'm in a deprivation. And it's just really nice. And I've done that every month for 9 months. And I've had no arrhythmia since. So I'm a big believer. I don't think I need to do it anymore. So I suspended it for July because I'm probably, because I'm traveling a lot for the next 2 months. So it's a subscription plan. And I didn't want to be paying for it if I wasn't going to be there to use it. So I suspended my membership for right now, but I didn't 2 a month for the first 2 months and then did 1 a month for 8 more months. And I would really consider that if I was having atrial fib that's going up on Carnivore. Make sure you're getting electrolytes, because that's not typical. Most people you hear with atrial fib have less atrial fib when they're on Carnivore. So there may be something else going on. And electrolytes are the most common thing. And I will never take a COVID vaccine again, because I already had a myocarditis in 2001. And I had the bout of atrial fib right after the vaccine, which I took because of my elderly dad, because I was doing a lot of care for him. And I just don't think it's worth the risk for me. So Steve Hall, how long does it normally take 100% carnivore before the skin issues? You'll have to tell us for you, because it's an individualized thing. I'll tell you, carnivore is going to put dermatologists out of the business. I had a really severe pustular folliculitis of my scalp, and mine went away the first week on carnivore. And I've not had any relapses for months. And I used to have to take doxycycline, which is a form of tetracycline, for 30 days, once for a whole month, every 3rd month. So I avoided 3 times taking 30 days of tetracycline, which then screws up your gut and everything else. And I'm so happy that it went away. It just literally went away with carnivore. And I did a follow-up with I went carnivore August 3rd, had my my annual follow-up skin eval by my dermatologist, who's a good friend of mine. We trained together. And I told him I have had none of my folliculitis, which I've had for 20 years. And he said, "Oh, that's typical. When people cut carbs out of their diet, their folliculitis goes away." I said, "Why didn't you tell me that?" He says, "Because most people won't do it."
Well, that was amazing to me, because I watched my brother's skin get really good on carnivore, but I didn't think it was happening for me, because that was one of the last things that kind of healed up. I still have lymphedema stuff healing up, but then it was actually just like 4 or 5 months ago, my skin finally started getting really good. And I was not expecting that. I thought I was going to be tougher. I don't know what it was, but I had these red sores around my nose and dry skin on my forehead and over here on my ears and stuff. And skin was always just flaking, and underneath it was red all the time. And I just had bad skin. And I don't know, in the last 4 or 5 months, it all just cleared up, and now I can even get tan without burning and stuff. It's crazy how much better my skin got.
Wouldn't you love to take a bunch of high school kids and put them on Carnivore and see if they can avoid the acne phase?
My nephew's got this terrible acne, and he's taken some pill that screws up his gut, and it actually almost gives him like he has to be careful when he's driving because he'll fall asleep because of this stuff that he's taking. It'll put him to sleep. And my brother was telling him, about Carnivore, and you got to get on it. And Bella, when I was talking to her, because she cleared up a bunch of real bad acne, and she said that that's absolutely a gut microbiome problem. And this kid's got 2 problems. He's got acne, and he's always on the pot. He's got something wrong with his stomach too. But he's taking like a pretty dangerous drug, and it's making him really sleepy.
Yeah, Carnivore. Steve Hall is talking to Carnivore at 60, and back on the subject of priming, I wanted to share, because the SPG people know this, but I want to share this on this video so it's captured. So I primed in November last year, and everything's gotten better. My body composition, my metabolic syndrome went away from priming. My metabolism reset. But in the month of May this year, I decided to go wild, which is I've been doing the levels at SPG, and going wild just means you just eat whenever you feel like it. And going wild, I pretty much ate 3 meals a day. I just felt hungry. I wanted to eat. I did a 72-hour fast during that month, but I basically ate 3 meals a day the rest of the month. And I went into the month of June and did level 2 in SPG, which is kind of an introduction to fasting. And I lost another 7 pounds just during the month of June. And I figured out that essentially I reprimed in the month of May and ate 3 meals a day for a month, except for a 3-day fast. And it was like kicking my metabolism again. So I'm pretty hyped because I'm thinking, hey, I'm just going to intermittently prime. And right now I'm on alternate day fasting. I'm fasting today. I started a day off, a day early on the level 3 because we had some social events and I didn't want to be fasting when the whole family was getting together. So I ended up, today's my second of 6 fasts I'll be doing over the next week, every other day, the 32 to 42 hour fast. And I feel great. I mean, it's fantastic. When you're doing nourish fasting, it's pretty easy. But I'm, for the first time in my adult life, down below my high school football weight.
Wonderful.
Was that on your bingo card on that one?
What's that?
I said, was that goal on your bingo card? Did you think?
No, I never anticipated I would drop that low. So now I've got to decide. My wife said, well, so what's your ideal body weight? And I said, I don't know. I'm 67. When I was a young man, my ideal body weight was 160, and I never weighed 160. I weighed 186. I'm 6 foot tall. And so I used a modern day calculator for my age and my gender and my frame and everything. And it came out to 171 pounds is kind of might be an ideal body weight, but I'm not really shooting for the ideal body weight. I'm just eating and seeing what happens because my gut has disappeared. And which brings us to one of the archived questions at SPG. Someone asked about how you get rid of abdominal fat. And you do that. I did that by doing sprints on a stationary bicycle. And I haven't done them all month, but when I'm back in Tampa, right now I'm in Atlanta, we're watching our grandkids for 3 weeks, but head back this week. But basically, I go to the YMCA and I warm up on the exercise recumbent bicycle, and I basically do about 10 to 20 minutes and I do anywhere from 3 to 10 to 15 seconds sprints on the stationary bicycle. I tried it on the treadmill, about broke my neck, so I'm not going to do that again. I can do it running, but I don't like to run on the street because you hit a pothole or something, it can throw you out at 67. I don't want to be falling unnecessarily in the bike. And I totally reduced my visceral fat in my abdomen. And I attribute that to the work of Sean O'Mara, MD. And if you haven't watched Dr. O'Mara's videos with his MRI studies of people getting rid of viscerous fat with 30 days of sprinting, and those are running sprints, but if you can't sprint running, you can sprint on an exercise bike. If you can't sprint on an exercise bike, you can do something on a rebounder. I mean, you can always do something, but it's isometric exercise, anaerobic exercise, not aerobic exercise. A sprint is anaerobic, which means you got to produce some lactic acid. And you can do that on an exercise bike. I just go from a rate of, on the exercise bike, I go from 60 revolutions a minute to about 110 revolutions, high intensity for 10. And I'll do 10 seconds, 13 seconds, 15 seconds, 20 seconds, 10 seconds. And I think it's important to alternate those number of seconds you do and alternate the number of sprints you do each day. You don't want to be doing the same thing every day. You want to mix it up a little bit.
That makes sense. You said something about lowering inflammation will help depression. Question.
I'm sorry, say that again. Oh,
you said something about lowering inflammation.
yeah, let's go back to page 2 on the, can you share back to page 2? So let's talk a little bit about depression. Somebody's got a bird.
Oh, sorry, that's me. I'll mute.
Is that anyway, loud bird. So if you look at depression over on the right side here, it's one of the things that's associated with obstructive sleep apnea, but it's also associated with inflammation. So why is depression so associated with inflammation? And if you can bring up my tryptophan pathway, Michael. This will blow your mind, a little biochemistry. So we're going to go from physiology to biochemistry. Okay, so tryptophan is one of your 8 essential amino acids. And tryptophan is the precursor on the left side to serotonin. And you see how tryptophan gets moved, converted through a couple of enzymes into 5-hydroxytryptophan. And then it gets changed into serotonin. And the serotonin is what your nerves uptake, and your serotonin levels, they get deficient when you're depressed. So why do they get deficient? So if you look at what happens with tryptophan, if you have pro-inflammatory cytokines, which are those chemicals being released from those degranulating white cells, you see it drives the tryptophan down a different pathway, and it goes into through a formaldehyde into some byproducts which are not good for your body. They're acidic to your body, and they're not good for your brain function. They do nothing for counteracting your depression. So you're shifting your pro-feel-good hormones, or neurotransmitters, I should say, away and putting them into inflammatory pathways, which create even more inflammation. And so these are waste products that your body then has to detoxify from. So a couple things. One is you're starving your body when you're in an inflammatory pathway, you're starving your body of serotonin. And then some people take SSRIs and they don't respond to them. And what the SRI does not cause you to produce more serotonin, it slows down the breakdown, the reuptake of serotonin by your nerve endings, and it makes the serotonin hang around longer, so it's more effective by duration, not due to quantity. So when someone's not responding to an SSRI like Prozac or Zoloft or Celexa or any of those, it's probably because they're deficient in the serotonin in the first place. And you're so deprived of serotonin because you've got this inflammatory pathway driving down, and it corrects very quickly. And that's why you hear so many carnivores that their mood gets better, because serotonin disruption leads to both anxiety and depression. Serotonin on the excess side and depression on the deficiency side. So this explains in one picture, one cartoon, the pathways that inflammation drives you away from healthy serotonin levels. And just it's anybody's guess how that's going to be for you when your serotonin levels are not allowed to auto-regulate the way that you were designed by God to auto-regulate. Isn't that amazing?
That's awesome. That makes so much sense.
And this is stuff I learned in med school, but we never talk about it in medicine because people don't know about it. We talk about give you a drug,
Right.
Well, why not turn off the inflammatory pathway and let your body be the natural drug? Because the serotonin will re-regulate if you take away the inflammatory pathway that's driving you into the serotonin deficiency.
That's awesome. Yeah, and why do you think that it's not talked about? I mean, is it just an honest?
Because there's too much money being made.
Yeah. Okay.
Pushing SSRIs and drugs. I mean, come on.
Yeah, for sure.
I'm
That's
surprised
what
they haven't put Prozac in the water supply of most major cities. It's a wonder drug.
Well,
But-
you remember, that movie Idiocracy where they turned all the water to Gatorade because it's good for you?
Yeah.
Yeah.
That's right. Yeah. More
Yeah.
sugar. Why not?
More sugar. That's
Susan
awesome.
Hampton mentioned Shaun White. Shaun White was my hero. It was a Shaun White interview by Carrie at Homestead How. Was the first time I ever heard the term carnivore as a way of eating. Obviously, as a physician, I know what a carnivore is, but the carnivore way of eating, I had decided to go on keto, and I had done keto for 2 weeks, and all of a sudden saw this Shaun White interview with his before and after. And Carrie was talking about the Shaun and interviewing him. He was talking about Ferrigno. I'm blanking on Ferrigno's first name.
Dante
Ferrigno. Yeah, talking about Dante and how he inspired Carrie and Shaun inspired me. And then Todd introduced me to the Steak and Butter Gang through one of his videos where him and Carrie were riffing about how much Steak and Butter Gang and priming helped him. And that's how I ended up over at SBG. And it's been life-changing. There's all these great influencers. And I always say the biggest problem with carnivore, we have so many great influencers. So you got to be careful who you listen to because you can get confused with too much information. Yeah. And I watched hundreds and hundreds of carnivore videos, and especially by all the carnivore doctors, Dr. Chafee, Dr. Ken Berry, Dr. Kiltz, Dr. Baker. Yeah, it's just endless. The number of Dr. Hampton. I mean, there's just so many good carnivore doctors out there.
And now we got Dr. Smith.
No, I'm not a carnivore doctor. I'm just a doctor who does carnivore. But I am far from being an expert. So I just know how the body should work if you let it. And that's my gig, is trying to teach people what's normal for the body. So let's go to page 3 of the PDF, Michael, and let's talk about why does carnivore work. And this is my conclusion, basically, of why carnivore works. First off, you're giving adequate protein, and you're making sure you're getting all the amino acids. And there are 20 amino acids that humans need. 10 of them we can manufacture. Most of us can manufacture 12 of them, but 8 of them none of us can manufacture. And there's 2 that some people can manufacture, majority of people can manufacture, but as many as 30% of people can't manufacture. So you'll see articles written and they'll say there are 8 essential amino acids, there are 9 essential amino acids, there are 10 essential amino acids. All you need to know is there are 10 amino acids that you may not get or make, and there's 10 that your body will make if you give enough fat to your diet, your body will be able to make. But you need all 20 to make healthy protein. And proteins are the structure of your muscle. They're 30% the structure of every cell in your body, the cell wall, the membrane, cell membrane. They're important for your bones, as I already talked about. And they're all your enzymes that guide all the chemical reactions. And so proteins are essential. You have to make protein. You don't have to have carbohydrate in your diet to survive. You have to have fat and protein. There are essential fats and there are essential amino acids. And you don't really store amino acids. You use amino acids in the pathways. And if you have excess, you can convert them even into glucose through gluconeogenesis. You have to have adequate fat. And I'm going to tell you guys for the first time, would you believe in when I was in med school, does anybody know what the ketones are called in your blood? They're called ketone bodies. Mm-hmm. And would you believe in the first week of medical school during orientation, we started, so this was in 1979, we started a co-ed intramural rec team to play flag football in the fall and softball. And the name of our team that me and my co-captain gave was the ketone bodies. So in 1979, my path to carnivore was already laid out. And my wife was a ketone body. She was a nursing student that we recruited. So my whole marriage, I've been destined to be a carnivore.
Yay.
Why carnivore? Minimum carbohydrates, because carbohydrates stimulate our insulin axis. And some people just can't tolerate them very well. Does that mean no one can tolerate them? No. But that means majority of people can't tolerate them. And if you look at about 90% of the US population has metabolic markers, I would guess that 80 to 90% of Americans don't metabolize a high carbohydrate diet well. So what does that tell you? Carnivore provides adequate minerals and vitamins. You don't get mineral and vitamin deficient, but you may start out mineral and vitamin and electrolyte deficient, so you have to get those replaced. But long term, you shouldn't feel the need to be taking high doses of any supplements. Iodine is one of those minerals that you may not get adequately if you live in the Midwest and only eat Midwest meat. Dr. Berry has done a great discussion about that people like me that live on the coast, the farmland in Florida, and the animals have more iodine in the soil. But I am supplementing with iodine because I've been hypothyroid since 2001 when I got severely sick. But mainly, carnivore reduces inflammation through a variety of mechanisms. It reduces cytokines, which are those chemicals that are released by your white blood cells, the antigens that are on things that are in your food, eliminating the pesticides and the herbicides that are put on our plants, provides nourishment, eliminates nutritional deficiencies, and replenishes proper level of hormones and neurotransmitters like your serotonin, your dopamine. And then you get this natural satiety, which I don't know anything that gives you natural satiety like a fatty protein diet does. Fat is just a natural satiety nutrient that makes you not want to eat as much. And that is what allows you to be so sustainable on it. And then doing nourished fasting promotes autophagy, which helps to repair damaged mitochondria, helps get rid of excess skin, and just helps healing all told. So these are all good things.
I love that summary. That is incredible.
So anyway, we've gone a couple hours here. I feel like I've covered a wide spectrum. Are there any other questions, Michael, that are, we have some commented questions. Lindy said I have to do the SPG gangs commented questions. So yes, Lindy, what are they?
I think Michael's got those. He'll bring them up. Yeah.
Michael, you're muted.
Yeah, because my AC is kicking on.
Oh, no. Is coffee discussed? Asking because I heard Richard Smith talking about the, what is that, acrylamide?
Acrylamide.
Acrylamide.
Coffee is being inflammatory. I don't know. I'm not an expert. And Richard Smith, I'm not going to take a stand on coffee one way or another. I went from a 10 cup of coffee drinker to drinking it once in a while. And I'm so thankful I'm not filling my body with so much coffee. And I came off in, let's see, it was October, 2 weeks before joining SPG. I had given up coffee. And I gave it up for 10 days. And when I drank it again, it tasted so bitter. It wasn't like, I didn't like it. But I started iodine about 2 months ago. And I'll have a half cup of coffee in the morning now with my iodine drops in it. When I need a little caffeine, when I'm at home, I tend to drink it with water. But taking on 4 kids under the age of 10, I need a little caffeine. So
Nice.
I think that's an individual thing that you need to decide. Next question.
Hi, recently I found latent TB, and if it didn't work in a high-risk area, National Intensive Care, and soon will be working at a high-risk baby and child clinic, and had autoimmune disorder, I probably wouldn't consider treating it, but I feel it's responsible for me to do so to protect the children that'll be under my care if I turn positive. My question is, do you think that a 4-month course of rifampin will stop/hinder my healing journey from type 2 diabetes, hypertension, chronic pain, Hashimoto's, and obesity? What are some things I can do to minimize potential toxic side effects? And third, medication requires take 2-hour post feeding. If I'm fasting, what can I do to decrease GI irritability?
Yeah. So in a nutshell, this is a neonatal nurse practitioner, and she's at risk, just like I was as a practicing physician, to convert your TB test. She's a converter, so we call that latent tuberculosis. The chest x-ray is normal, so she doesn't have active tuberculosis. But all that means is you've picked up the TB, which is very slow growing. And so we normally suppress the TB with single drug therapy called rifampin for several months. Back when I was in practice in the 90s, we used to give it for as long as a year. But now they only give it for 4 months. The funny thing is rifampin, which is kind of works through the same mechanism as erythromycin, is actually a fairly safe drug, and it's actually taken on an empty stomach to get better absorption. So the fact that she's fasting, this is a great time to take rifampin. And personally, I recommended to her offline that she go ahead and do the rifampin, because the risk of her, if she converts to active TB, she would have to go on 3 different drugs for probably a year to 18 months. And even then might not be cured. And so kind of your responsibility as a healthcare provider when you're actively taking care of at-risk populations, especially neonates, which are preemies, premature infants. You want to make sure that you're able to work and you're not a risk to your patients. So I really recommended to her that she go ahead and do the rifampin. It's unlikely she's going to have any problem to the single drug therapy. Most people don't. I've treated a lot of people with rifampin through the years for this very thing. And I've never had anyone that I've had to stop it from. Doesn't mean she won't be the first person, but the alternative is to not be able to work in her passion area and also converting to active TB and being a risk for her patients. And ultimately having to go on 3 drug therapy. So everything in medicine, you need to look at what I call the risk-benefit equation and decide, is the risk worth the benefit worth the risk, or is the benefit less than the risk? And I would say the rifampin, your risk-benefit ratio is very favorable to take it. So I would lean that way, but ultimately it's her decision what she does. But she may be told she can't be in the NICU as a converter because it's probably her employer that made her take the test in the first place.
That's awesome. Next slide.
Hi, I'm curious about the cortisol and adrenal connection. Yeah. Since carnivore almost 3 months, I've not lost weight, still deal with belly fat. My cholesterol went way up. I think I'm a hyper responder. I'm 5'2", weigh 125 pounds. It's difficult for me to consume large quantity of food. Well, you're pretty much an ideal body weight. 5'2", your ideal body weight, if you're a female, is about 110 to 120. If you're a male, it's 115 to 125. So you're in that range. When we're stressed out, it is harder to lose belly fat when our cortisol levels are high. Our adrenal gland is what produces adrenaline and cortisol. And so you do grounding, get up, watch the sunrise, get adequate sleep, try to get in good circadian rhythm, try to deal with stress management, adequate sleep, fatty meats, don't smoke, don't drink. These are all things that can help you. But if your cholesterol is way up, you have to look at the triglyceride HDL ratio. So if your triglycerides are under 150 and your HDL is greater than, I would say, 40 in a male and 50 in a female, I wouldn't worry about my LDL cholesterol. And I would say priming is a great way to reset your cortisol levels. So even though it's hard to consume large quantities of food, I would work your way up to it. We've had people in SPG that have to eat 6 small meals a day just to get enough calories in for 2 weeks in order to prime. And we have one person that Todd and Lindy and I know really well, who's one of the coaches, and she eats every hour while awake when she's priming. So you do what you have to do, okay? And but the belly fat definitely is the one I was talking about with the sprinting. That's probably the number one thing to do when you're not priming. Do the sprints, but don't do sprints during priming. Give your body a little rest for a month and then do the sprints. Next question, Michael. My last several surgeries were severely impacted with autoimmune flares. Yeah. Priming before surgery, great idea, and doing some fast. If I could get SPG and do priming for a month and level 2 for a month before I have surgery, I would say that's like the best thing you can do. And I may need a rotator cuff repair. I had a rotator cuff injury before I became carnivore, and carnivore made my pain go away. And about 3 months in, I decided I wanted to see if I could do chin-ups, arm raises. And I did it even assisted at the gym where you put counterweights on it. And I was only doing 50-pound weight against my body weight. So I was doing a net pull-up of 50 pounds and had immediate, I think I tore my rotator cuff doing that. So silly me, even carnivores can get injured. And I developed an impingement syndrome, had to go through PT, and now I have a pacemaker, and I'm going through this whole rigmarole to get an MRI done, which I'm having done when I get home, but I have to do it in the hospital with a pacemaker tech at the ready because he's got to reprogram my pacemaker immediately and make sure I don't die on the table. It's like, oh, I hope I don't need my rotator cuff repaired, but I'm pretty sure I tore it completely. And I may go ahead and do it, but I'm doing pretty well right now. I have good range of motion, and I just can't sleep on my right side. So fortunately, I'm left-hand dominant, so it's not as bad as it could be. So I would say if I was prepping for surgery, I would do a month of priming and a month of nourish fasting, and get myself really optimal. And you're having surgery in less than a month, so I would probably do 2 weeks of priming and 2 weeks of either intermittent fasting or do several 48-hour fast before your August 12th. And then I would nourish the day before I go in for surgery. Okay?
Awesome.
And I would tell them they're not allowed to give me glucose-containing IVs when I'm in the hospital.
There we go. How about having severe gastritis and
No, gastroparesis. So gastroparesis is where your stomach emptying is messed up. So this is one of the number one complications of semaglutides, the GLP-1 inhibitors that everyone's taking, those Ozempics and those. They work by paralyzing your stomach, and some people get severe gastroparesis. A BZOR is a collection of food that actually causes an obstruction of your stomach. The first patient I ever had die in my career was when I was a PA student, a physician assistant student. I was a senior in college. She was a 98-year-old lady. I remember her dearly, healthy. She was on no medicines. She had false teeth. She went to a birthday party of her friends, ate bean sprouts, ate Chinese restaurant, and got a bean sprout BZOR, a big clump of unchewed bean sprouts, clogged her small intestine, called it bowel obstruction, and she came into the emergency room with 80% of her small bowel in gangrene, just dead. And we had to take her to surgery, take out 80% of her small intestine. And at 98, when you go through something that severe, she only weighed like 80 pounds to begin with. She lived alone, totally alert lady, Scottish lady. I'll never forget her. She was the sweetest lady. I did her admission, history and physical, scrubbed in her surgery, and she had a horrible post-op course because she was relatively malnourished, and we took away 80% of her bowel, and she just couldn't recover from the stress of that major surgery and never made it out of the hospital. And I'll never forget her, but she died of a BZOR, of bean sprout BZOR. So the point is, the best BZOR is the one you never get, right? And this is why I'm so opposed to this indiscriminate use of Ozempic and these other drugs, because, people are getting these BZORs from this in their stomach, and it's taking months for them to resolve, and they're in terrible pain. But so you have to start with very small feeds, just like someone who's had stomach gastric reduction surgery, whether you've had a lap band, a lap sleeve, Roux-en-Y, any gastric reduction, anything that reduces the size of your stomach, you should definitely be eating frequent small feeds, chewing your food really, really, really well. Start with things like ground beef, which are much easier to chew, fish. Make sure things are, you can get ground lamb, you can get ground turkey, whatever. Chew really, really carefully and do small quantity of foods. And I also found that after you eat, within about an hour, you want to have some water, and you're trying to flush the stuff out of your stomach because your gastric emptying is slowed. And I've seen people with gastroparesis literally have reflux of bile or stomach acid 6 hours after a meal. So they can eat at 5 p.m. and go to bed at 10 p.m. and still have reflux. And that's usually a sign that your stomach's not emptying. So you need to kind of prime your stomach with a little bit of fluid afterwards. Not before the meal, but after the meal. Because if you do it before the meal, you won't want to eat anything because the water just sits there. So anyway, that would be my strategy. And don't go on Ozempic. If you've never been put on Ozempic, don't go on Ozempic. And don't have gastric reduction surgery, right, Lindy? Any other questions?
I think we have.
Dr. Phil, I have a chronic elevated CRP, thyroid antibodies, HCY levels. I'm not sure what that is. We'll get these normalized with time, most likely. Cold plunge has also been associated with cold plunging, so it may bring it up too. I mean, it's been associated with decreased inflammation. Absolutely. I have a friend that swears by cold plunges. Even cold showers can help reduce inflammation. But eating fatty meats and getting carbohydrates out of your diet is the best way to reduce inflammation. I just think there's too much testimonials about that. And at some point, people say, oh, it's anecdotal information. Yeah, anecdotal to what are there? At least 3 million people in the carnivore community now. Probably 300,000 when I started a year ago. So, it's like, when does it not become anecdotal? Just because it hasn't been studied in double-blinded peer-reviewed studies doesn't mean it's not beneficial. There's just too many people of all ages getting healthier eating fatty meats. Oh, HCY is homocysteine. So homocysteine is an inflammatory marker that some people get and is also associated with the increased risk of atherosclerotic heart disease. I'm blurry on the screen because I have a filter on. MJ. And you all open that, it's my hemoglobin A1C. So someone's posted their hemoglobin A1C. So I don't see it posted, so I don't know. I went from 11.6 to 5.8 in 7 months. Unbelievable carnivore at 60. That is fantastic.
That's awesome.
That is fantastic. We had someone just join SPG that went from a 15 to a 4.8. It's unheard of. I practiced medicine for years, never saw anyone do that. That's amazing.
That's incredible.
Oh, it's Murdad. So, yeah, great job, Murdad. That's life-saving. Oh, MJ is Murdad. Okay. Just type in, just carnivore at 60, just, you typed in the numbers, that's fine. You don't need to post it. So I'm fine if you post my PDF in the show notes, Michael.
It's in there. I got it in there, yeah.
Yeah.
Yep.
If people want to download it. The purpose of doing this is to capture my thoughts on this and have a discussion. Hopefully, I've made inflammation a little less mysterious to all of us.
And everybody in the SBG, so that they know, well, I'm going to have, we're going to edit this down too. So we'll have the full version, but we'll also have an edited version of just Phil going over his flowchart information. And then we'll have a full version with answering all the questions as well. So we can have
great
this version.
Okay. Did I get most of the questions, Michael?
Here's one up here right now. Something about I have what I thought was an autoimmune issue from a flu vaccine that caused permanent numbness in my feet and hands, like I'm wearing socks and gloves. And the stronger pneumonia vaccine has caused muscle and bone pain in my legs. I have neuropathy from both, and on duloxetine to help with the pain. Should Carnivore take care of that?
Yeah, great. So it's interesting. The most common cause of what we call that stocking glove peripheral neuropathy, when it affects your fingers and your toes, it's like you're wearing a numb glove and a numb socks. We call that stocking glove, stocking being the feet and gloves your hands, peripheral neuropathy. And the most common cause of that is insulin resistance, diabetes. Now, the interesting thing is you can also get interesting neuropathies with many of the autoimmune diseases. The question is it a different mechanism or is it the same mechanism? I think that all of it is inflammatory because, and I think we do a disservice when we start dividing up, into, well, I have this autoimmune disease, or I have this autoimmune disease, or it's due to this medication or whatever. I am convinced that PPI, proton pump inhibitor meds, given for prolonged periods of time, they're only supposed to be used for 2 to 6 weeks. People that take them for years, I've seen too many cases of people who develop peripheral neuropathies on long-term PPIs, which is why I think they're overprescribed. And for all of them, it takes, peripheral neuropathy is due to toxicity of the nerves, and the nerves may be demyelinated or they may be dead. Nerves, if they're not cut, can regenerate over time, but nerves grow very, very slowly. And if you think about it, the cell body of a nerve lives in your spinal cord. And so your fingertips and your toes are as far away from your spinal cord as they can possibly be. So peripheral neuropathy takes months to years to resolve if they're going to resolve. And we just don't know how much toxicity you have. And is it only inflammatory toxicity, or is it a neurotoxicity of these, what they call it, forever drugs, forever chemicals that get in your body that you just can't get rid of? But I would be hopeful, again, that you're going to get better with time, but do not expect it to occur overnight. My dad has peripheral neuropathy at 94, almost 95. He's had no improvement since getting rid of all the processed foods and basically being a ketovore. He eats fatty meats every day and has only about 3 vegetables and 3 fruits that he ever eats. And he only does it seasonally on the fruits. So, and I do that just to keep him interested in food because I don't want him to lose more weight, but he looks great. It's amazing how healthy he is and how independent and clear-minded he is. But I'm hopeful for him that, God willing, he lives to be 100, that he won't die at 100 with peripheral neuropathy. I just don't know how long it's going to take.
Right.
Okay.
Did we get all the questions, Michael? Because did we get the one that was asking? I had one that was asking if inflammation if inflammation causes varicose veins, and if carnivore can heal it, and also if inflammation and impact on DVT, if that can be resolved with carnivore as well. And also, I had one about ringing in the ears, if that's inflammation.
The last one was what?
Ringing in the ears, if that's inflammation.
Oh, ringing in the ears. I thought you said bringing in the ears. I thought we were getting ready for a corn harvest or something. I don't know about tinnitus. Tinnitus, tinnitus. Itis means inflammation, but tinnitus can be due to multiple things. It can be due to barotrauma. It can be due to sound trauma. Barotrauma being pressure trauma, like scuba diving. It can be due to sound trauma, which I have some hearing loss due to going to college in Cleveland and getting front row tickets to too many rock concerts. And the next day, my ears would ring, and that's actually the little hair cells of my cochlea, my inner ear, being plucked out, which is permanent damage to your cochlea. So that's non-reversible with carnivore. But a lot of people have tinnitus due to inflammation. So it really depends on what the cause of your tinnitus is, on whether or not it reverse. What was the other question? DVT we already talked about at length.
Yeah. So how about varicose veins? Can that be?
So varicose veins is really due to a breakdown of the valves within your veins. And there's definitely an inflammatory process contributing to varicose veins, but there's also an obstructive process, which is related to weight and lymphedema or fluid retention. And I'm sorry, I wasn't prepared to talk about lymphedema and talk about that. I did want to talk about some other things like cystocele, which is a cystic change of the scrotum that actually occurs and causes enlargement of the scrotum. And that's an inflammatory process. If you think about it, most cystic processes in the body are related to inflammation, whether you're talking about sebaceous cyst, cystic acne, cystoceles, renal cyst, and they're also associated with iodine deficiency. So if you have a lot of cystic conditions in your body, polycystic kidneys, polycystic liver, cyst on your scrotum if you're a male, I would highly consider iodine supplementation, and there's protocols of how to start that. I'm not going to go into that tonight, but those would be things. Lymphomas, which are fatty tumors. If you get inflammation out of your body, you should quit making them, because cysts turn into tumors, tumors turn into cancers, and you want to use adequate iodine and anti-inflammatory diet to get rid of both of those. But once you have a lipoma, which is a large collection of abnormal fat cells, it's unlikely to go away. These large, massive lipomas probably need to be surgically excised. But the thing is, you want to get rid of the inflammation because, number one, you'll heal better. Number two, the surgery will go better. And number three, you're going to stop making them if you don't have the inflammation. And even skin tags will fall off when you reduce inflammation and get your insulin resistance and discoloration of your skin from acanthosis nigrans, which is associated with diabetes, goes away when you get your insulin resistance healed. So
it's awesome.
There's a lot there.
That is a lot.
Cranky Carnivore Color said his tinnitus went away after 7 months on carnivore. So that's really good. I don't have tinnitus. I just have hearing loss, high frequency hearing loss.
That's awesome. Well,
I think there's a lot we're going to discover from Carnivore through the years, but it's going to be one. I see too many people with non-scale victories who are having things happen positive to their bodies that they never signed up for. Not why they're doing Carnivore, and all of a sudden it's like, oh my goodness, I woke up and my right shoulder doesn't hurt anymore, which is what happened to me. But then, like an idiot, I went to try to do a chin-up and tore my rotator cuff because I'm trying to act like I'm 20 and not 67,
It is fantastic, though. And some of those things are, I think we forget what not hurting feels like, like we forget what we're supposed to feel like.
It's crazy. It's like we were talking in SBG last couple days about mosquito bites. I don't get bit by mosquitoes, or we have these terrible things called no-see-ums, which my backyard, I live on a lake and it's all forested, on a forested lake, and 55-acre lake. So we get all kinds of mosquitoes and no-see-ums. Do you have no-see-ums down under?
I haven't heard of them.
I've heard of them before. No.
You don't see them. We call them no-see-um, and they
no-see-um. Okay.
they bite you. You never see them. They're very small. Right. They bite you, but you get this huge histamine reaction, and they're incredibly itchy. And the only thing that helps is putting like Crest toothpaste on them so they don't itch, or Caladryl lotion. But I go outside all the time now in my backyard, and I don't have to put Deep Woods Off on anymore because I don't get bit by mosquitoes or no-see-ums anymore.
What do you think that is? What do you think that is?
My blood's not sweet, I guess.
That's hilarious.
I don't sweat anymore either. I haven't worn deodorant for years. I mean, if I do something extremely stimulant, I'll get stinky just like anyone else. But day to day, I do not sweat doing day-to-day activities. I mean, I'd have to go run a marathon to sweat. Wow. It's something really rigorous, but my day-to-day life, and you were talking about your heat intolerance in Austin, Todd. And yeah, I used to have heat intolerance too. I'd sweat like a dog, but that all goes away when you get the weight off and the inflammation out. So.
Yeah.
I'm looking forward to it. I do think it's just, what was crazy? Yeah. When I got really sick, I couldn't sweat. I get hot, but I could not sweat.
Yeah.
And it was making me sick. In fact, I would get really nauseous and dizzy when I was trying to walk on the treadmill and couldn't sweat. And I had a weird cold feeling about it when it was happening. And I think it was some sort of nerve damage or something that was going on, some kind of neuropathy, maybe from all the fluid. Something weird was going on, but I couldn't sweat. So I was actually very happy when I got healthy enough to start sweating again, because I was like, I was actually worried that some kind of neuropathy had happened or something.
Yeah, and Nathan and Renee Shove, they're saying one of them has an autoimmune neuropathy. Been on Carnivore for 4 months. They're off duloxetine and nortriptyline, which is a antidepressant that's used, and they're on Neurontin, which is gabapentin, and they're doing chemotherapy treatment. I'll tell you, that's great that you're doing better. I don't have much faith on Neurontin or gabapentin. I've not seen very many responses to it. I know it's prescribed a lot, but I really think healing your nerve endings and fatty meats to get your myelin to regenerate your nerves. If your nerves aren't totally dead, they can grow new axons, but they only grow at a couple millimeters a week. So it takes months for those neurons going to your toes and fingertips to regrow. So don't give up, just stay consistent. But I think you should have hope, Katina and Nathan, yeah.
That's incredible. They're in SVG. Both of them are in SVGs.
Okay, super. Awesome. Well, it's been 2 hours and 43 minutes. I think the doctor filled me out.
I appreciate it, man. Phil, this is awesome, and everybody's so engaged. So I love this. I think we should have you back on sometime, maybe next month, and do one with I'd love to hear you talk to Dr. Leslie and Keith about lymphedema. I'd love, because you can ask much more intelligent questions than me. So
yeah, that would be pretty cool. And I'd talk about my obstruction model, right?
Yeah, exactly. And so on the lymphedema, because here's what I've been noticing. I mean, inflammation's a huge topic. Lymphatic system's a huge topic for our crowd. And then also like nerve function and nerve and autoimmune function is a huge one. So I'd love to get into those topics a little bit more, because that seems to be a lot of what everybody's hurting with, as well as, metabolic disease and diabetes.
Yeah. I'm glad to see Susan Hampton's must live in the Florida Gulf Coast too. You see that? She knows what no-see-ums are. So I live in Odessa, Florida, in Hillsborough County, northwest Tampa. So
that's awesome.
Oh, everything in Australia is quite big. You see their teeth coming before them. So
yeah, if you've ever seen a photo of a piranha with the big teeth, little fish and big teeth, I assume that's what a no-see-um looks like under the microscope.
It's all just jaw and teeth, tiny little body.
So anyway, well, I hope I said at least something halfway intelligent, and appreciate everyone's patience with me. I do give long answers, so.
No, well, you're not to Dr. Chafee levels yet, but you're getting close.
But we did post the references of everything on obstructive sleep apnea. It's fascinating peer review research, and we know that, everybody thinks sleep apnea is due to obesity, and that's it. End of discussion. And it's like, no, it's not that simple.
If that was true, I'd still have sleep apnea, and I don't.
Same with me. Mine's gone.
Yeah.
You and Carrie motivated me to do the research, and the literature is really clear that it's inflammation, silly. So,
awesome. Yeah, this is exciting. I was just thinking when we were doing this was such a success. We should almost do like a SBG video series on some of these topics that can be handed out in the open chat.
Well, I think just understanding normal physiology. I one day on open chat talked about every phase of the digestive system from your mouth all the way to your other end, and what happens in each phase, so when you have a problem what's going on. Because if you know what the normal is, it's real easy to figure out what you need to be doing to fix something.
For sure.
It's in your mouth, your esophagus, your stomach, your duodenum, your jejunum, small bowel, or your large intestine, or your gallbladder.
Yeah, I'd love to know that too. And not only that, but if somebody would have told me, I didn't even, and of course I should have went and looked on my own too, but if somebody would have told me back in the day that that there was other things that we're eating, putting crap in our mouth for, that wasn't just fuel. That didn't even dawn on me back then, because once I started thinking that way, then priming made sense, right? When you realize that when you eat empty fuel, but you're not getting nutrients, and your body can't be healthy without the nutrients. And all the dietitians that I saw never said anything about that. They just said, red meat's bad for you, fat's bad for you, and so go eat stuff that doesn't have that in it. Well, if you stay away from fat and red meat, you're basically going to carbohydrates and plants and sugar, And those things are they're nutriently deficient, and so you're just eating all this fuel. And if somebody would have explained it to me that we need the building blocks too, then it would have made more sense. And that's one thing. I was like, how do people not talk about that? Because that flipped everything around for me when I realized you can be 700 pounds and not eating enough, not eating enough of the right things.
Yeah. Well, it's interesting how many vegan influencers are dropping dead in their 20s.
Right.
And here you got all these carnivores in our 60s and 70s, and you don't hear any of us dropping dead.
Right. But lo and behold, you don't have to look at that inflammation, but your cholesterol might get you. Is it what it puts you in the 1% risk?
Yeah,
or something?
that's right. You got to take this $300 a month med for the rest of your life, and it has a 1 in 200 chance of helping you, and has a 40% chance of harming you. But we want to take it because we don't like that lab test value.
Right.
It's ludicrous. It really is ludicrous. So,
So crazy.
and I just wanted to wrap up to come full circle with the obstructive sleep apnea. I'll bet you anything with these new studies that I posted showing the inflammation connection to obstructive sleep apnea, it would be a real kicker that at some point, will they ever change the medical model to say sleep apnea is not a disease of obesity and it's a disease of inflammation? Because,
Right.
they now, the way these articles, and I recommend you read them, they may be over your head, but when you find that there are inflammatory markers that can be measured in people with obstructive sleep apnea, and people are still saying, well, isn't that interesting? We guess obstructive sleep apnea causes inflammation. Well, hello, maybe the inflammation is causing the obstructive sleep apnea. And it's not occurring to the researchers yet because you've got a split between the doctors who are treating people at the front lines and the biochemical and biophysiologic researchers who are observing all this data and finding all these connections between inflammation and sleep apnea, and they're not talking to each other. So it's crazy.
Well, and that's the way that I feel about obesity. I feel like they have obesity backwards. I feel like obesity doesn't cause inflammation and sickness and all these diseases they credit it for. I feel like those things are at the very least parallel symptoms that are both caused by probably inflammation and the diet. But at the very least, it feels like these sicknesses cause obesity. I almost feel like I feel like I'm almost lucky now to weigh what I did, because I feel like it saved me from a lot of the toxins and poisons. Like I could have ended up with a way worse disease.
So imagine this. Let me blow your mind. So maybe obesity is the marker of inflammation, not inflammation the marker of obesity.
Right. That's what I've been saying. I feel like everything's backwards.
It is. It
Yeah.
is. So
That's incredible.
So anyway, there's people on the chat that said they've had lamb steaks, lung phone call, and we're still going. Cranky carnivore, cutler steak, pound of beef heart, half pound of kidney during this live, and we're still going. So let's get off. It's almost my bedtime here.
Yeah. Thank you so much, Phil.
Thank you.
Thank you, Dr. Phil.
Wonderful.
And keep motivating people. You guys are great.
Thanks so much, Phil. We sure appreciate you so much. We'll see you,
See
Phil.
ya.
Bye.
See ya.
Bye, guys.